We're here again to sort through the sources you've sent our way, find those really key insights, maybe some surprises, and figure out what it all actually means.
That sounds good.
So today, we're plunging into, well, a really fascinating area, mobile devices and their connection to very young children, really young.
Yeah, from birth practically up through the toddler years. It's quite the topic.
It is, and we've got two pretty different sources to look at.
Right. They give us different angles on this.
Exactly. First, there's a study. It's from the European Journal of Pediatrics. And this one gives a really detailed look, I think, at direct mobile device use. We're talking kids aged 1 month up to 60 months.
So babies right through to preschoolers.
Pretty much. And then
the second source, this one's research published in PLOS 1. It takes a completely different tack. It looks at whether mothers owning mobile phones might be linked to their baby's health right at birth.
Okay.
And this is specifically in low and middle income countries, LMICs.
Got it. So different settings, different aspects of mobile tech. Our mission then for this deep dive is basically to unpack what these studies found.
Yep. What do they tell us, maybe together, about how mobile tech is showing up in the lives of really young kids and their families?
Right. And what's the potential impact? What should we, take away from all this?
Okay. Let's dive in.
Let's do it. Where should we start? The European study.
Yeah, let's start there. The European Journal of Pediatrics 1. So this study really digs into the how and when young children are actually using mobile devices themselves.
Right.
They surveyed, I think it was over 400 parents with kids in that 1 to 60-month age range.
And the first thing, it just jumps right out, is how common this is.
Uh-huh.
The study found overall exposure really high. 75.6% of these kids under 5 had some kind of exposure.
3/4, that's a lot.
It is.
And what's maybe even more striking, maybe a bit unsettling for some people listening, is just how early it starts.
Yeah.
The median age for a child's first use of a mobile device, they reported it as just 12 months old.
12 months. Wow.
And get this, the youngest child they documented using a device, just 6 months old.
6 months. That feels incredibly young. It really shows how embedded these things are, doesn't it, if it's happening that early?
It really does. And the study mentioned, interestingly, that tablets seem to come into play at a slightly different average age than, say, phones.
Ah, okay.
But, while most kids were exposed, it wasn't like they all owned their own device.
Right.
Overall ownership was, let's see, around 30.7% among those kids who'd actually used one. And as you'd probably guess, that number went up as the kids got older.
Makes sense. And if they did own one?
Tablets were the big one. Yeah, parents reported tablets made up something like 68.4% of the devices their kids actually owned.
Okay, tablets are key here for the really young ones.
Seems so. Now, here's where it gets maybe a bit counterintuitive. They found this inverse relationship. So, tablet use and ownership by these young kids was actually linked negatively with household income and the mother's level of education.
Wait, hang on. So lower income and lower maternal education were associated with more frequent tablet use and ownership for the child.
That's what they found in this group.
That feels surprising. You might sort of intuitively expect the opposite, right? More resources, maybe more tech access. What could be going on there?
Well, yeah, that's the million-dollar question this raises. The study does give us some clues, though, about why the kids were using them.
Like what?
The most common activity, watching videos. Over 70% of parents said that.
Okay, passive consumption mostly.
Seems like it.
Yeah.
And significantly, almost 60% of parents said they let their kids use devices while the parents, were trying to get chores done or, other daily tasks.
Ah, okay. So it starts to paint a picture. Mobile devices, particularly tablets, often used for watching stuff, maybe keeping kids occupied when parents are busy. And this seems, based on this study's findings anyway, to be happening more often, or the ownership is higher, in homes maybe facing more resource constraints.
That seems to be the suggestion from the data on frequency and ownership. It suggests it's not just about having the tech, but maybe how and why it gets used in different family situations.
Right. It's becoming part of the daily routine, maybe filling different needs depending on the circumstances.
Precisely. Woven into the fabric of family life. And there was another really striking statistic in that study.
What was that?
A huge majority of parents, 91.5%, said they had never actually been informed by a doctor about, the potential effects of mobile devices on their young children.
91%. Never told by a doctor. Wow.
Yeah.
That really points to a pretty big gap in guidance for parents, doesn't it? Trying to navigate this whole new world of early childhood tech use.
It certainly suggests that.
Okay, so study number 1. High exposure starts super early. Specific patterns like tablet use for videos, sometimes as an occupier, and this kind of surprising link where lower SES seemed correlated with more tablet use in this group.
That's a good summary. Now let's shift gears a bit.
Okay.
Let's connect this to that other dimension we mentioned. Not the child using the device directly, but the indirect impact of the mother having a mobile phone.
Right. This is the PLOS-1 study in low and middle income countries.
Exactly. They used a really large data set. It was from demographic and health surveys covering 29 LMICs, data from over 100,000 mothers and their recent births.
And the focus was specifically on birth weight.
Yeah, birth weight and the risk of low birth weight, which is usually defined as under 2,500 grams or about 5.5 pounds.
Okay, so what was the main finding?
Well, the core finding is actually quite positive, quite encouraging. They found that babies born to women who owned a mobile phone generally did better.
Better how?
In terms of birth weight, they were on average heavier at birth, and they were also less likely to be born with low birth weight.
Just the fact that the mother owned a phone was linked to a healthier start.
That's what the association suggests. It's a really strong link they found.
Interesting. Tell me more about the numbers.
Okay, so just looking at the raw numbers, there was about a 2 percentage point difference in low birth weight. It was 15.7% for babies whose mothers had phones versus 17.7% for those whose mothers didn't.
Okay, a noticeable difference.
But then, importantly, they did statistical adjustments. They controlled for things we know matter, like the mother's education, household wealth.
Right, the usual socioeconomic factors.
Exactly. And even after accounting for those, the link held up. Mobile phone ownership was associated with babies weighing, on average, about 31.6 grams more.
Okay.
And critically, a 1.8 percentage point lower risk of being low birth weight.
Wow. So even when you try to account for things like wealth and education, which we know influence health, there's still this separate association with just having a phone. That's significant. It suggests the phone itself might be providing something extra.
Precisely. Which, of course, leads to the next question. How? What could be the reason?
Yeah, what are the pathways?
The researchers looked into a few possibilities. One really key pathway seems to be better access to healthcare.
Ah, okay.
They found that mothers who own phones were significantly more likely to have more antenatal care visits during pregnancy.
Makes sense.
And also more likely to have the birth attended by a skilled health professional. You know, a phone can help you make appointments, get reminders, maybe call for help or advice when you need it.
That makes a lot of sense, especially in places like many LMICs where just navigating the health system can be tough. A phone could be a lifeline almost.
It really could be. Another pathway they explored was around information and awareness.
How so?
Well, they found some evidence, for example, that receiving information about family planning via text message was linked to higher birth weight in some of their analyses.
So the phone as a channel for getting crucial health info.
Exactly. Info that might otherwise be hard to come by.
Yeah, you can see how even simple text messages with the right health advice can make a real difference, particularly for mothers in remote areas or maybe with lower literacy.
Absolutely. And here's another really interesting finding. This positive association between the mother having a phone and the baby's health. It was strongest among mothers with lower levels of education.
Really?
Yes, and also strongest in countries where, overall, infant health outcomes were generally poorer to begin with.
Okay, that's a powerful point. It suggests that mobile phones might actually be a tool for improving health equity,
It could be.
potentially giving the biggest boost to those who are most vulnerable or have fewer other ways to access healthcare and information.
That's certainly what the findings imply. And they also noted the link was stronger in countries where more people generally had mobile phones, higher mobile phone diffusion.
Which might mean,
Well, perhaps where the mobile network and ecosystem are more developed, there are more ways to leverage that technology for health, maybe more mobile health programs available, things like that.
it paints a really compelling picture of potential benefits. But we should mention the limitations, right? This was association, not necessarily causation.
Absolutely crucial point. This study used cross-sectional data like a snapshot in time. So we see phone ownership and better birth outcomes are associated. They happen together.
But we can't definitively say the phone caused the better health outcome.
Exactly. It's like, noticing people carrying umbrellas are less likely to be soaked in the rain. The umbrella is associated with staying dry, but it didn't cause or stop the rain.
Good analogy. It shows a relationship. And those pathways, healthcare access, information, give us very plausible reasons why that relationship might exist.
Precisely. And they also pointed out something important about the data itself. Information on birth weight was often missing, particularly for poorer, less educated mothers in these surveys.
And what does that mean?
They suggest this missing data likely means the study actually underestimates the true positive association.
So the real benefit linked to a mother having a phone might actually be even bigger than what they were able to measure with the data they had.
That's the implication, yes.
Okay, so bringing it all together, we have these two really interesting but quite different studies.
Definitely.
One showing us this picture of very high, very early, often quite passive direct use of mobile devices by toddlers and preschoolers. Plus that sort of unexpected inverse link with income and education for tablet use, at least in that specific context.
Right. A very close-up look at direct interaction.
And the other study reveals the significant, though indirect, link between a mother just owning a phone and her baby having better health outcomes at birth in LMICs.
Yeah, pointed to these vital potential pathways like better healthcare access and getting important health information, suggesting the benefits might be greatest for the most vulnerable.
They really do show us two very different sides of how mobile tech is just becoming fundamentally part of early life, don't they?
Absolutely. From direct screen time for the child to being an indirect but potentially crucial health tool for the mother even before birth.
And it feels like the research is just trying to keep up, as the technology itself keeps spreading and changing so fast.
No question, it's a rapidly evolving landscape.
So it really makes you stop and think, doesn't it? When you consider how deeply integrated mobile technology is becoming, from potentially boosting health outcomes before a baby's even born to being just, they are in the daily routines of toddlers. What are the long-term implications here? You've got the intended effects, like the potential health benefits, especially maybe for vulnerable groups.
Right.
But then also the potential unintended consequences of this. Really widespread, really early, and sometimes quite passive exposure we saw in the first study. How do we even begin to balance all that?
That's probably one of the big questions, isn't it, for this generation is growing up completely connected right from the start.
Wow.
How do we navigate the benefits and the potential downsides?
Yeah, finding that balance seems key.
And research like the two studies we discussed today, they give us really essential pieces of the puzzle as we try to figure that out.
Indeed. Well, thank you for joining us on this deep dive.